The American Academy of Pediatrics is sort of like saying pediatricians in a couple select periods of time should screen for autism. First of all, what would a pediatrician be looking for if you thought maybe some of the early signs of autism from your experience would be what a doctor should be looking for?
Well, there are really three parts to a diagnosis of autism in the modern age, and one is children that have poor interpersonal skills, the second is they have language impairments, and the third is that they have repetitive behaviors.
Well, a 4-month-old doesn't talk. So what would you look at a 4-month-old, sort of like a little communication is something that say maybe, oh, there's a red flag, we have concern?
Well, a 4-month-old may not be moving as well as another 4-month-old. It might not mean that it's going to be autistic, but it might mean that it might have neurological problems. It may be floppy. 4-month-olds do make eye contact, and they do have some social skills, but not so much that it's hard to distinguish between what's abnormal.
Will they smile looking at the mother's face at 4 months?
Oh yes, they do, and they'll even smile at others' faces by 4 months. But again, this is not a very quantitative kind of thing.
But if you saw a kid that wasn't looking at the mother at all, wasn't smiling at the mother, looking for a smile back at 4 months, you would have great concern at
yes,
that kid.
Of course, you would worry about that child.
And if a kid was about a year old and wasn't doing any form of communication, that means not only words, but expressive communication, which is reaching out, trying to get you to do things, that be also a big concern, sir?
Yes, that would be a red flag.
Now, if either one of those two cases were there, would that be a good reason to refer to a pediatric neurologist or an infant stimulation developmental type of program?
Sure, if there are any delays, those children should be referred either to a pediatric neurologist or a developmental pediatrician, or just to depending on how extreme the delays are and what's going on, or to an early intervention program.